Next up, we have Lauren Hare. She just completed her MSc at UC Davis in Carly Moody's lab, and she is going to talk to us about the influence of owners on veterinary appointments in cats.
Hope you're all ready to hear more about cats, because I'm ready to talk more about cats. So today I'll be talking about veterinary appointments with the owner present versus absent, where we're assessing cat responses and owner attitudes. Cats require routine veterinary care in order to ensure their health and welfare throughout their lives, yet approximately 60% of owners don't take their cats in for those annual veterinary examinations. A factor for this could be that cats show signs of stress and fear during examinations due to things like being in an unfamiliar environment and being handled by unfamiliar people. Thus, not only does this impact diagnostic procedures, owners also report an increase in their own personal stress when their cats show these negative behavioral responses. And as a result, this reduces their willingness to bring in their cats for future vet visits. Yet, there are increased efforts to improve the cat and owner relationship in regards to experiences in vet clinics, where we have seen in dogs that there is a reduction in fear-related responses when the owners were present during examinations, but there are a lack of research in the impact of owner presence for cats in this case. Oops, not yet. Thus, we're going to be assessing cat responses during a routine veterinary examination where the owners are present versus absent, where we predict we're going to see both a reduction in negative behavioral responses as well as physiological responses when the owners are present. Now, we're going to assess owner attitudes via a survey with their perceptions on common appointment practices. Specifically, I'll be focusing on owners rating themselves and how they rate their cats as being more comfortable during examinations and procedures when they're present, but we also predict that owners are going to report that they're going to be more comfortable when absent during procedures like blood draws and urine collections. Now we'll get into our methods section. So we started off with a recruitment questionnaire to determine eligibility. From there, we had a pre-examination questionnaire. And with that information, we were able to have our appointment order counterbalanced based on the cat's age and their sex, and then randomize it. So for example, if the owner is going to be absent for the first examination, after a 2-week minimum washout period, they would be present for that next examination. We distributed this cute flyer out to the greater Sacramento area to recruit owners. In the case of both online as well as in-person distribution, we had owner inclusion criteria requiring that owners own at least a cat. They live within an hour of the UC Davis Veterinary Medical Teaching Hospital and be 18 years or older. Cats were required to be 1 to 10 years of age and be 50% or more indoors to have a cat-owner relationship. We also wanted to make sure that the cats were healthy with no pre-existing medical conditions and have no sedation medication to ensure no behavior was impacted during the examination process. With that, if eligible, they then took a pre-examination questionnaire, which was a cross-sectional quantitative survey of 55 questions, so a very big survey. Some of these questions had owner and cat demographics, and today we're focusing on owners' opinions on presence during appointments, for examinations, as well as any routine procedures. And we're also looking at outdoor access since that was one of our requirements. So we want to see what kind of outdoor access they had. For the appointments, both were the exact same with the exception of the owner being present for one and absent for the other one. So they would be outside of the room. There were 4 phases. The habituation phase, where the cats habituated by stepping out of the carrier and habituating to the table for 2 minutes. The assessment, where we assess the cat's behaviors on the table prior to any examination. The examination phase itself, where I conducted a routine exam on the cat. And then the post-examination, where we assess their behavior in the room for 30 seconds, and they were allowed to jump off, as you can see here. And these videos were also recorded so we can use them for our behavioral responses. So during the examination, I got physiological responses like heart rate, respiratory rate, and pupil dilation pictures. during the examination or with the videos, we were able to look at video behaviors such as lip licking, vocalization, face out of view, and latency. And for our reliability, my assistants were trained to have pilot study videos to determine both inter and intra-observer reliability, requiring a 0.75 or higher for both the ICC as well as the Cohen's kappa. For our behavioral responses, we had mixed linear and Poisson regression models. And today, with the explanatory variables, I'm only going to be focusing on the outdoor access as well as the treatment effect in this case. For our survey responses, we had a Likert scale, so we used Wilcoxon signed rank in regards to presence during those examinations, as well as any procedures like blood draws and urine collections. And so now we'll move into our results, where we found for our cats, most participants were 3.3 years old and male. And for that outdoor access, when I say supervised outdoor access, it's going to be cats that had supervised access, such as catios or leash walks when given by the owner. And any cats that are free roaming means they have no supervision from the owner if they were provided outdoor access. Most of our human participants were women that were ages 18 to 39 years old and lived in a suburban area. And for my major behavioral and survey results, I'm only going to be presenting significant findings for those two treatment effects. And I have a lot of data, but not a lot of time to talk about it. So you can always reach out to me after this. We did find an effect with presence on vocalizations when we used an incident rate ratio, measuring how frequently the vocalizations occurred during the habituation phase and how frequently they occurred during the examination, where we found that cats were less likely to vocalize when the owner was present when compared to absent. We also found no other treatment effect. No, the treatment did not impact any other specific behaviors in this case. We also saw outdoor access had an effect, which we were surprised by in regards to vocalizations per minute, as well as other behaviors, where we found that cats that were given supervised outdoor access were less likely to vocalize when compared to those indoor only, as well as compared to the free roaming. And this was regardless of the treatment effect in this case. And these two phases that we looked at were prior to the examination for those. With our survey results, we asked questions and used we used a Likert scale in regards to both comfortability as well as agreement statements. So I asked owners, when your cat is undergoing an examination or a procedure like a blood draw or urine collection, how does this make you and how does this make your cat feel when you are present versus absent for these? In this case, we used a Likert scale going from very comfortable to neutral to very uncomfortable, with our percentages of responses on the y-axis. In this case here, when owners are present in the examination, it's going to be that dark purple. And when they're absent, it's that light purple, where descriptively you can see most owners rated themselves as feeling very comfortable when present during an examination, and most owners rated themselves as feeling somewhat uncomfortable when absent during the exam. This now is going to focus on the owner's perceptions of their cat comfort levels using that same Likert scale as prior, or in this case, for owner presence, it's going to be dark blue and owner absence is going to be light blue, where you can see that owners rated their cats as feeling both very comfortable and somewhat comfortable when the owner's present during the examination, and most owners rated their cats as feeling somewhat uncomfortable and very uncomfortable when the owner is absent during the exam. In this case, we changed it up by making an agreement statement going from strongly agreeing to strongly disagree with the question, when my cat needs a routine procedure, I am comfortable being present in the treatment area or absent from the treatment area. In this case, presence is once again in that dark purple like before, and the owner being absent from that treatment area is that light purple. Descriptively, you can see most owners rated themselves as strongly agreeing to being present in that treatment area with the cats during blood draws and urine collections. And most owners strongly agreed and somewhat agreed this time to being absent from the treatment area when these procedures are needed. To summarize our results, we found that with owner presence, reduced vocalizations during the habituation phase and the exam phase. We also saw that cats with supervised outdoor access were less likely were less likely to vocalize when compared to those other two groups. And for our survey results, participants were more comfortable for both owners and cats being present during routine examinations. And owners also reported themselves as being more comfortable when present in the treatment area for any procedures that need to be done. With this, cat vocalization has been seen before in regards to owner and cat bond attachments, where research has shown an increase in vocalizations in cats when owners are absent. But we are also aware that there are contexts of increased vocalization during negative effects. And as I mentioned before, veterinary clinics are full of a lot of negative stimuli, and such as being in an unfamiliar environment and surrounded by those unfamiliar people. As a result of this, we tried to replicate a veterinary examination as much as we possibly could for that real world effect. Thus, not only do we see an impact in those vocalizations, we might also see an impact in other behavioral responses, like we saw very limited physiological responses in our case for our study. And as a result of this, we should try for future research to make a more controlled setting in order to ensure greater generalizability for these behaviors. With outdoor access in veterinary medicine, to our knowledge, this was one of the first studies that actually looked at something like this. We weren't really planning on looking at it. We just kind of threw in the question because we were interested in knowing. So more research should explore the impact of how does outdoor access improve potentially veterinary clinic experiences for cats. And with our survey results, we should suggest giving owners a choice to be present in the room during any procedures and during the examination. And since we had a small sample size, as we were located to the greater Sacramento area, more research should be done to assess owner attitudes on a greater scale, which we do have a survey on actually. So we just finished up the analyses, or I think we're doing the analyses right now for it. It was a big study based on both California, sorry, I'm from California, but both Canada as well as the US. So I want to give a big thank you to my collaborators who helped me with this, my undergraduate research assistants, the Animal Welfare Epidemiology Lab, and the Center for Animal Welfare. Without all you guys, I wouldn't have been able to do my thesis. And thank you all, and ready for questions.